Hello and welcome to a special bonus episode of the Oncology Nursing Podcast. I'm Katrina Loutzenhiser, the ONS Staff Liaison for the Leadership Development Committee, also known as the LDC. Today, you're going to hear from the candidates for the ONS 2021 election. This year, several excellent candidates applied for consideration to run in the ONS election. Each year, the LDC looks for individuals who will be the best fit for the ONS board, taking into account skills, experiences, overall composition, as well as expedient needs. The LDC vets candidates through a rigorous process. Candidates submit a notification of intent, and after careful consideration, including grading on a rubric, some candidates are invited to submit a full application. The application process is quite intense, and the LDC again gives careful consideration to each of these candidates. With each level of review, the committee narrows the slate down to the most qualified candidates who are also the best fit for the current needs of the board. This can be very difficult because we have so many talented people in our membership. For the 2021 election, we have an incredibly strong slate of candidates. It is now up to the membership to do the next part and decide who should represent them on the board. ONS is an organization that values and is committed to ensuring diversity, equity, and inclusion. We asked each candidate to tell us how, as a board member, they would envision advancing diversity, equity, and inclusion. The candidates will present in alphabetical order by last name, beginning with Valerie Berger, Assistant Vice President of Cancer Operations at Northwell Health in Huntington, New York, and member of the Long Island Queens and Suffolk County ONS chapters.
How and where you were born, work, and live your daily lives all determine how healthy or unhealthy you are. How do we expand access to care and advance diversity, equity, and inclusion? As a board member, I would leverage our more than 35,000 members as windows into the lives of our communities. Who better than us to lead the way toward equity? We see disparities in care every day that we care for patients. More Black men have prostate cancer, more Black women die from breast cancer. Women in rural areas are twice as likely to die from cervical cancer. We are the windows into making a difference, and it can be done. The state of Delaware enacted a statewide screening program for colon cancer, and in 7 years, erased disparities in screening rates, reduced the percentage of African Americans diagnosed with metastatic disease, and abolished racial and ethnic differences in colorectal cancer incidence and mortality. We know that 80% of health outcomes are influenced by cultural and social encounters. That's almost everything other than medical encounters. Partnering with our communities is the way to achieve change. Partnering with organizations like the American Cancer Society and local community governments is something I have done in my career in New York and can be modeled for us for around the country. As a board member, I would take that experience and develop it into community cancer education programs. True healing needs compassion, and we know compassion. Together, we will make an impact. Thank you.
Next up, we have Danye Garner, nurse educator at MD Anderson Cancer Center in Houston, Texas, and member of the Houston ONS chapter.
Cancer affects patients from a myriad of diverse backgrounds. A reflection of those who are diagnosed with cancer should be in those who advocate for them. Approximately 25% of the nursing workforce self-identifies as being an ethnic minority, which is a disparaging gap compared to the population in general. In line with ONS's values and commitment to ensuring and advancing diversity, there are opportunities to guarantee a steadfast success. Representation of diversity can be accomplished with added attention to examining the communication platforms to membership that are most likely to reach a diverse audience. In line with ensuring advancing equity, attention to creating equivalent opportunities for oncology nurses from where oncology nurses are, regardless of where they are, is pivotal. Lastly, in line with ensuring and advancing inclusion, attention can be applied to including members who possess various academic degrees, varying years of oncology nursing experience, as well as including members whose professional talents may have been developed outside of the sphere of oncology nursing. It is through ensuring diversity, equity, and inclusion that defines ONS as an organization that leaves no member without positive impact. And it would be my absolute honor to be amongst a diverse consortium of oncology nursing professionals advocating for every member of ONS, the seen, unseen, heard, and unheard on the ONS Board of Directors.
Next, we have Patricia Getty, Clinical Nurse Specialist at Orlando Health in Winter Park, Florida, and member of the Central Florida ONS chapter.
How do I envision advancing diversity, equity, and inclusion? 3 words come to mind: recognize, respond, and respect, with intention and mindfulness. Being mindful in recognizing the diversity in our peers, practice, and patients we serve. We come from a variety of backgrounds of education and experiences. We practice in a variety of settings, specialties, and roles where we deliver care. We represent all regions of the country, encountering patients of various cultures, ethnicities, and lifestyles. We can be intentional in sharing and using these perspectives and experiences to guide our current and future plans of oncology nursing. Intentionally respond by actively seeking to include diverse members in the development and revisions of our practice, guidelines, standards, and position statements that reflect their views and perspectives. We need to hear from oncology nurses that represent all areas of practice and experiences. Inclusion of diversity will open doors for discovering innovative ways to address the growing needs of our patients, their families, and the communities we serve. Demonstrating respect by ensuring all have equal opportunities to be heard and contribute. We can be more intentional to seek out the untapped talent in our membership. We need to explore all resources as we move forward. Thank you.
Next, we have Christine Ladd, Manager of Patient Care Services at Sentara Norfolk General Hospital in Virginia Beach, and member of the Southeastern Virginia ONS chapter.
We all know that ONS has always been committed to excellence in oncology nursing, recognizing that cancer is an epidemic and the fight against it is being waged every minute of every day around the world to patients and by nurses of every race, ethnicity, gender identity, faith, age, sexual orientation, and belief system. ONS's diverse community of nurses are experts on making connections, leveraging these as a means to provide highly effective communication that leads to better outcomes for patients. It is this connection that makes oncology nursing so vastly different from any other specialty of nursing, and is the reason it's so important to listen, learn, and embrace our differences. I firmly believe that we learn best through stories. As a board member, I will be deliberate in asking for and telling the story of others, giving voice to those who have been traditionally oppressed, because each story is small but equally important in a piece to a larger puzzle. I will strive to engage members from different backgrounds so that as equal partners we can identify and effectively address gaps in care and resources. I will look for areas of opportunity and ask tough questions. What are we missing? Who can we better serve? Where are we missing the mark? And how can we work together to better understand each other so we can better serve our nurses and our patients? And I will continue to model behavior that is reflective of love, equity, inclusion, and respect for all.
Next, we have Joseph Terraman, Associate Professor at DePaul University in Chicago, Illinois, and member of the Chicago ONS chapter.
Hello, Oncology Nursing Society members. It is truly an honor and a privilege to be part of the 2021 ONS national election. The Leadership Committee would like me to share to you what my vision will be if I get elected as a board member in terms of advancing diversity, equity, and inclusion. I did a little bit of research on that one as far as what I can read in the Oncology Nursing Society website, and it appears that it is part of our values, but it's not clearly stated in a position statement that we have diversity as one of our main core values. I think that that's one thing that we need to include in our position statement. And also for the 2020 and 2022 ONS strategic plan, diversity is also not one of the top 4 priority areas for our strategic planning. So I believe that that needs to be also included in the next oncology strategic planning, and make sure that we have actionable items that would represent the activity in order to achieve the goal of improving or enhancing the diversity. Thank you.
Next, we have Trey Woods, faculty administrator and instructor of radiation oncology at the University of Mississippi Medical Center in Jackson, and member of the Central Mississippi ONS chapter.
Hello. ONS is an organization that's dedicated to ensuring diversity, equity, and inclusion. Now, I would like to take a brief moment and explain how I would use my platform if given the opportunity to advance these efforts. First, I'm committed to continuing an ongoing dialogue between ONS members, leaders, and staff around the importance of improving diversity, equity, and inclusion across the organization. Now, I believe it's important to highlight the real and perceived barriers that have historically and presently prevented participation from underserved and underrepresented groups. Now, awareness and perception are important, but I believe that an organization like ONS has a responsibility to maintain a system of measurable metrics and scalable ways of promoting accountability across the organization. Now, I will work to make sure that such systems are in place and are functioning effectively. I don't pretend to have all the answers around these important topics, but I am committed to raising awareness, and I am committed to improving diversity, improving equity, and leading inclusively. Thank you.
Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part of this episode by leaving a review on iTunes or wherever you download your podcasts. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org.